It is Wellness Wednesday. Did you know colorectal cancer is the third most common cancer in both men and women? Today in the sponsored segment, we are joined in studio talking with Dr. Mustafa Huseini. He's a gastroenterologist at Memorial Healthcare Gastroenterology. He's talking about Colorectal Cancer Awareness Month. Good morning.
Good morning. Thank you for having me.
Yeah, thank you for coming in. Let's get right to it. Why is it so important to have a colorectal cancer screening?
Well, as you mentioned, it's the third most common cancer in the United States and globally in men and women, and it is preventable with timely screening and early detection.
Yes, talk about being proactive. Talk about the importance of having a screening, and for folks watching, what age should they start doing that?
Well, according to the American Cancer Society, it is recommended that all adults age 45 and above should have some form of colon cancer screening. This helps by detecting precancerous conditions like polyps, and also early detection of colon cancer, and early detection saves lives.
Yes, it does. And I know some folks out there may be a little intimidated by the screenings themselves. We'll talk about that in just a moment, but more importantly, what are some of those signs or symptoms that people should be looking out for when it comes to colon cancer?
Yes, that's a good question. So a lot of them are subtle. The signs are vague. They're noticeable, and some of them are silent. So some of the more noticeable signs are abdominal pain, diarrhea, constipation, rectal bleeding, abnormal weight loss, fatigue, sometimes nausea and vomiting.
And that's why it's so important to have the screening itself, because you said there could be some silent symptoms.
Correct.
So walk us through, how does a colonoscopy procedure work? What do people need to know so they're not too afraid of it?
Sure. So colonoscopy is performed under sedation. The day before actually, the person is prepped with giving some laxatives to clean out their colon. They come in the next morning. They get some light sedation. Once they're sedated, the colonoscopy is performed with the doctor looking inside the colon for polyps, which are abnormal growths, and these are precancerous conditions. Majority of the polyps that are removed are precancerous. So if they're removed at an early time, that prevents colon cancer from happening. So polyps are precancerous abnormal growths inside the colon, and removal of polyps is the best way to prevent colon cancer.
Well, overall, are there things people can be doing just to stay healthy in general, to try to prevent getting to that place in the first place?
Absolutely. So anytime you have any symptoms, or when you see your doctor, make sure you mention of any signs or symptoms. But more importantly, talk with your doctor and get your screening done at an early age, at the right age, and also have a follow-up colonoscopy as recommended.
Well, bottom line, you will guide people through the process, right?
Correct. Yes.
You'll get excellent treatment. Our thanks to Dr. Mustafa Huseini, again, a gastroenterologist at Memorial Healthcare Gastroenterology. There's more information on your screen, a website you can go to if you have any questions. But we really appreciate your insight in talking about this important topic.
Thank you very much, Matt.